Dr. Nicole Cluccio. I am doing this segment on twins. So congratulations, you're having twins. Now, when you came in for your ultrasound, I don't know if you were expecting to have twins, like you've been trying for years and years and now you're ecstatic, or if you thought you were going to have an ultrasound and have a single baby and it turns out that there's two. Now, I have twins, so I understand that it is completely overwhelming, regardless if you were expecting it or not. I, for one, was pretty much in denial until 12 weeks. And yes, like I said, I do in fact have twins. So with twins, there are a couple of different kinds of twins that you can have. So you can have twins that are di-di, meaning that there are two separate sacs and two separate placentas. You can have monodi twins where there's a single placenta but two different sacs. Or you can have mono-mono twins, which are very rare, which you have two babies in one sac and they share one placenta. There's no membrane separating the two twins. A lot of times in the first trimester, we find that people with twins have a lot of nausea and vomiting. So if you felt like you were so sick and you're still sick, it's really common. And hopefully by 20 weeks, you'll feel a lot better. There are some screening tests that you can get, though they aren't as accurate for twins. In the first trimester, if you really want to know that the chromosomes are normal, you would need to do CVS testing, and we'd have to send you out for that. In the second trimester, you can have an amniocentesis, in which case both sacs need to be tested to see the chromosomes of the babies. Otherwise, you can have a screening test, which is the sequential screen, and that can help tell you your risk of Downs trisomy 13 as well. You can have a nuchal translucency done, which is the back of the neck measurement on both babies, and that's fairly accurate for giving you an estimate on whether or not the baby has Downs. So you may be saying, why do I have so much nausea and vomiting in the first trimester? That's because your beta-HCG levels, which is the hormone of pregnancy, are significantly higher with twins. The other thing that will definitely happen to you during pregnancy is you'll become anemic. So you might become significantly short of breath, your heart might be racing, all of this is normal. Usually you'll have to take some extra iron. And if you're taking iron, it's my recommendation that you also add some stool softener, Colace into that so that you don't get constipated. In a normal pregnancy, just like with twins, you're going to have a sugar test done around 28 weeks. For that test, unfortunately, you are more likely to fail it because you have two placentas, which gives you more of hormones that will increase your risk of gestational diabetes. Hopefully, if you fail the first test, when you have the diagnostic test, you might pass that. What other things do we need to know? It's important that we do growth scans on twins, regardless of what type they are, di-di, mono-di, or mono-mono, because there can be a growth discrepancy. It is not as common in di-di as it is in the other two. Specifically for mono-di twins, because they're sharing a single placenta, one twin may get lots of good nutrition and the other one may suffer. So for them, we usually start doing ultrasounds at 16 weeks, every 2 weeks. We will probably send you out to high risk if you have mono-di twins or mono-mono twins for close monitoring of the fetal growth. So what else is special about twins? Well, you're going to be uncomfortable. That certainly happens. You get bigger sooner. You might have a lot more cramping, a lot more discomfort, back pain. There are just also other risks that come along with having twins, unfortunately. Hypertension. So hypertension has become more and more common in pregnancy. And unfortunately, it's common as well for twins. And Also, it's an increased risk of preeclampsia. So it'll be very important for your blood pressure to be checked frequently. And it's always a good idea to get a blood pressure cuff for home and check your blood pressure in the morning and in the evening. Write those down, keep a log so that we can review it with you and see if you're having issues with high blood pressure or if we're more concerned about preeclampsia as well. And that we'll check your urine for protein for that. Diabetes, if unfortunately you fail your 1-hour sugar test and then fail the subsequent diagnostic test, you will need to be referred to endocrine for diet management and insulin if needed. Now remember, diabetes is not under your control whether or not you get the diagnosis in pregnancy, but how well it is controlled is up to you. Other thing, preterm labor and preterm delivery. So twins do have a higher potential for preterm delivery. I myself delivered my twins at 33 weeks after I went into preterm labor. So we keep an eye out for that. We ask about contractions all the time. If you're having concerns, give us a buzz and we will go over everything and see whether or not you need to be seen. Also, we will do something called non-stress tests later in the pregnancy, where we put both babies on the monitor along with the uterus to see if it's contracting. We do it for about 20 to 30 minutes. It makes us be able to see that the babies are healthy and doing well, and also whether or not you're contracting and don't know. Usually for di-di twins, they tend to deliver between 36 and 37 weeks. About 25% will have premature rupture of membranes and will deliver for that reason. If for some reason you've made it to 38 weeks with your twins, then you will be delivered either by induction or cesarean section, depending on the presentations. This is specific for di-di twins. For mono-di twins, usually they're delivered between 34 and 38 weeks. It all depends on whether or not you develop a twin-to-twin transfusion syndrome, where the one baby is getting more nutrition than the other baby, and then usually we intervene. Most of the time, mono-di twins are delivered by cesarean section. And then mono-mono twins generally are the earliest delivered between 32 and 34 weeks. Because there's an increased risk if you go further of something happening with one of the babies. So we talked about how you might deliver early. So preterm birth is one of the risks. The growth discrepancy is one of the risks. Diabetes, hypertension, preeclampsia. There's also an increased risk of C-section, mainly because even if you're having di-di twins, we prefer that they're both head down. So if they're both vertex, both head down, you can go ahead and try for a vaginal delivery, even if you've had a cesarean section in the past. There's no reason that you can't VBAC as long as the incision on your uterus was good in the appropriate way. If baby A is head down and baby B is not head down, then there's a discussion to be had between you and your provider about whether or not you want to have a vaginal delivery and see if baby B cooperates and comes out vaginally, or if you want to have a planned cesarean section. If baby A is not head down, then you will be having a cesarean section. At any time during delivery, you do have a higher risk of increased blood loss. So the uterus is larger, you're having twins, it's more distended, there's more fluid, and we need the uterus to really clamp down to decrease your bleeding after the babies come out. If for some reason it does not cooperate appropriately, then we normally have lots of medications, and in last resort, we do have blood transfusions to give you if need be. However, the majority of twins deliver perfectly fine without the need for a blood transfusion. Now, postpartum. Okay, so anything we should look out for postpartum? The answer is yes. So there is an increased risk of postpartum depression. It's probably a combination of factors. So you have hormones that change dramatically after the babies are born. And some people are very sensitive to those and get postpartum depression. It's normal in the first 2 weeks to just cry for absolutely no reason. Those are the baby blues. But you have significant sleep deprivation and hormone changes with having twins. I hate hate to say it, but unfortunately, it's a lot of work the first year. You know, if you're breastfeeding, great. That's awesome. There's no reason that you can't. You can do tandem feeding where we show you how to do football holds. You may need to supplement with a little bit of formula if you don't have a good enough production, but that's okay. There's no reason that you can't also breastfeed. If your babies are preterm, then you should anticipate that they may need to have some high calorie extra formula to increase further weight gain. I personally breastfed one of my twins because they breastfed really well. The other twin, on the other hand, did not, so I pumped for that baby. And I was supposed to supplement since they were 33 weeks, but I didn't do it for a particularly long time because they fed and grew really well on just breast milk. But I'll tell you, it takes a really long time for them to feed in the first couple weeks. Don't be alarmed, it gets much quicker. So where you think that you're always feeding or pumping or doing something like that, it definitely feels that way in the first couple of months. They get quicker and you get more time without being attached to a baby. If you think you're having postpartum depression, please call, because sometimes it happens between visits and we don't want you suffering at home. So please call us if that happens. All right, so let's see, is there anything that we didn't touch on that might be important? Like I said, I found that being diagnosed with twins in the first trimester completely overwhelming. And it took me a good 12 weeks to be on board with the fact that I was having twins. However, my husband was super excited. I was probably less excited only because I knew some of the risk factors. And to be honest with you, I happen to also have labile hypertension. So I'm one of those women who, you know, as soon as you sit down and put that cuff on my arm, my blood pressure goes nice and high. So I was not excited to have that as a problem going on in the pregnancy. And then I had preterm contractions. I failed my 1 hour sugar test and needed to do a 3 hour, which luckily I passed. And then I went into labor and had my babies. My second baby was breech, so I chose to have a cesarean section. Postpartum, I just think, is exhausting. You know, both my babies were in the NICU for a couple of weeks, which is generally an actual really short amount of time. Usually they'll always tell you if the babies come out early that they won't go home until closer to their due date, but as soon as they're doing certain criteria that they need to meet, they will send them home, but they are well taken care of in the NICU, so you shouldn't worry about them if they end up there. Other tidbits for having twins. The best advice my sister ever gave me, and this is probably for a singleton or twins, is to double up when you are putting the waterproof mattress pad and the fitted sheet on your crib mattress. So waterproof mattress pad, fitted crib sheet, waterproof mattress pad, fitted crib sheet. So then when it's the middle of the night and one of the babies has thrown up, has had a poop incident, has done anything where it's all a mess, you can just pull off the waterproof mattress pad and fitted sheet that's on the top and you're good to go with a nice clean one. And I found that to be super helpful. I'll also tell you that I am on board with if one is up, the other one should be up, because hopefully that'll mean that you'll have less time up in general. And it's just fun. Even though it's overwhelming and really hard work, don't let anyone tell you, oh, I would never want twins, or that's awful, or it only gets worse from here, which I definitely heard from other people when I was out with my children. And you'll make it, because we all do. We do what we can, and we all make it. My kids are 13 and they're doing great. So I look forward to seeing you in the office. And if you have any questions about twins, I'll be more than happy to answer them.